It is bad that your urine is the same color as Coca-Cola or Malaysian context, teh-o urine. Hi, I'm Dr. Balraj from Pantai Hospital, Kuala Lumpur. I'm a consultant hepatobiliary surgeon. Today, I'm going to be answering some of the common questions we have about the hepatobiliary disease. What is the hepatobiliary system? It's a collection of organs that are composed of the liver, pancreas, gallbladder, and the bile ducts. They all take part in detoxification as well as transport of enzymes for digestion and hormones for optimal bodily functions. Is it normal for people to have yellow skin? No. Yellow skin or jaundice is a sign of an underlying liver problem which may be either due to a problem with the liver or a blocked bile duct. This may progress and worsen if left untreated and may cause further damage to the liver like cirrhosis. You wouldn't really notice the yellowish discoloration yourself, but your acquaintances may point out to you. Seek help immediately as this may be a treatable problem if diagnosed early enough. Can I live life normally without a gallbladder? That is a resounding yes. Gallbladder is necessary for storage of bile. The bile is produced in the liver and transported to the gallbladder via the bile ducts. When you eat, the gallbladder contracts and bile flows via the ducts into the duodenum for digestion of foods. And in the absence of the gallbladder, bile flows continuously into the duodenum and gets reabsorbed at the last part of your small intestine. So, you can still enjoy all your foods even after your gallbladder is removed, in moderation of course. Is it good for diabetic people to lose their appetite? Well, yes and no. Weight loss is always good, but unintentional weight loss may be a sign of a malignancy lurking in the background. Poorly controlled diabetics may of course lose weight due to a chronic disease. But if you have good diabetic control and are still losing weight, take that as a sign that more testing is required. Late onset diabetes, however, is known to be associated with pancreatic cancers. If you do experience unexplained weight loss, seek a consult as soon as possible. Can my tumors be burned? Well, technically speaking, yes. Logically speaking, we don't actually use a lighter to burn, or ablation as we say. It's an ultrasound guided procedure where a needle is introduced into the tumor to ablate it. It is used in small liver and pancreatic tumors with clear planes from other organs. Is it bad if my urine is the same color as Coca-Cola? It is bad that your urine is the same color as Coca-Cola, or what we like to refer to as tea-colored urine or Malaysian context, teh-o urine. It is a sign of an underlying liver or biliary tract problem. It is usually accompanied by jaundice and it is usually evident earlier than when your skin has become noticeably yellow. If you do notice Coca-Cola colored urine, get a liver function test done urgently and arrange for a doctor's consult. Does fried chicken cause or worsen gallstones? It ain't just fried chicken. Most fatty foods are directly associated with gallstone disease. There are three types of gallstones that we know of: cholesterol stones, which are self-explanatory, pigment stones, which are due to anemia-related issues, and mixed stones, which are a mix of cholesterol and pigment stones. The larger part of the population harbor gallstones which have no symptoms whatsoever. Sometimes they may cause problems like pain and jaundice, and this is usually exacerbated by consumption of a fatty meal like fried chicken. And that worsens when you add sugars to the equation. Does smoking increase the risk of liver cancer? We don't know if it does, but smoking is the only known risk factor for pancreatic cancers and bile duct cancers. Yes, there are notable risks and have no direct correlation, but of course, prevention of any sort is better than surgery. Liver cancers are usually associated with hepatitis B and C viral infections. Getting cure of your hepatitis doesn't exactly translate to a reduction in cancer risk, so continued follow-ups are necessary with your neighborhood hepatologist. Another more alarming risk of liver cancers are fatty liver disease, and that is usually due to excessive alcohol and or fatty food consumption. Once the risk is alleviated, the cancer risk becomes negligible. Why do I have itchy skin without rashes? Itchy skin in the absence of a rash may be a warning sign of a biliary tract obstruction, but it is usually associated with deep jaundice. An obstructed biliary system may be due to stones, or worse yet, a cancer of the biliary tract system or a pancreas. This is due to accumulation of bile salts which get deposited in the skin. and over-the-counter meds may help alleviate the symptom temporarily, but the underlying cause needs urgent attention. Is chemotherapy the only treatment for liver cancer? No, it isn't. Very, very early stage primary liver cancer, liver transplant offers a 70% cure rate. In more larger tumors, surgery may offer cure for that particular tumor and can be downstage for liver transplant later. Larger and more advanced liver cancers may be tackled by targeted tumor chemotherapy or radiotherapy treatments in a multidisciplinary team. Only very advanced tumors require systemic chemotherapy, but those are usually treated with palliative intent. So that's all the questions we have for today about the hepatobiliary system. If you have any questions, please leave them in the comments below.